Proton beam therapy is a form of radiation treatment. So radiotherapy, as we normally understand, is used with X-rays, and for many patients, X-ray treatment still remains an excellent choice. Proton beam therapy is different because protons have a particular property. They travel into the body, treat the tumour, but then any normal tissues that sits beyond the tumour is saved any exposure to radiation. This is particularly important in children and teenagers because many of them are still growing. And actually, if we could spare that normal tissue, it means that we can cure your cancer and your survivorship is better because you have less long-term effects from it.
We've got 4 treatment gantries at UCLH. Patients usually have about 5 or 6 weeks of proton beam therapy in total, and it's really, really important that we make sure that the patients are in exactly the same position every day for their treatment, and therefore we create bespoke immobilisation. So it can be something like a head shell, or it might be something called a vacuum-formed bag to ensure that the patients are in exactly the same position. Before, patients had to travel abroad. Bringing proton beam therapy to London means they can stay much, much closer to home.
When we were thinking about how to design it, we really wanted to put the patient experience at the centre of it.
We're fortunate to have had charitable funding, which has uplifted many of our areas.
If parents are relaxed, their children relax. And that means that when we're setting you up for proton beam therapy, it's easier and faster, and that means that treatment is more accurate. So all these little bits really add up to a better patient experience and better patient outcomes.